Far beyond witches and wizards is the root cause of health problem of many in Africa. Seek professional advice concerning that your health matter.
I see with my clear eye. The eye that I cannot be able to use 2 years ago, I use it now to see everything. And I say, may God who make this man have this mind, and all those doctors will be here. God will bless them and give them more life.
Join Dr. Save a Life Foundation.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Hello, what a wonderful privilege to be with you again. Today we are going to have something special because I'm here to be in position to let you know, review that your doctor knows. Perhaps he has not been able to let you know concerning what our people are passing through in terms of their health. There's something that we normally call diagnosis. Oh, what is responsible for your problem? That is to say, what is responsible? You call it diagnosis of that particular health problem. But did you know there is something doctors know, that what you may call diagnosis is not what they call diagnosis? Because diagnosis of a disease comes to a doctor in different formats. It comes, number one, with what a doctor will call differential diagnosis. And he will go further again to have what is called tentative or working diagnosis. And then he will finally come to a point where he will make what is called definitive diagnosis. This I will tell you why some people will be doing all their treatment based on one of the first type of these other diagnoses we've talked about, and they get so confused. That's why in this country we have been battling with the problem of misdiagnosis or poor diagnosis or no diagnosis at all. On that very basis, you have the opportunity to be in position to have a right information. Even what you may be passing through in terms of your health condition, what your loved one, what your friends. It doesn't matter what they will tell you. And we reveal to you that more than the eyes can see, when you hear that somebody has a chest pain, oh, I'm having chest pain, my friend, is beyond that. Why not do us a favor? Call your friends. Ask them to tune into this radio station now. I tell you, just one thing they will get is a safety for their health, for their family, and the society at large. Do it. I will be right back.
Hello, I am Pastor Barrister Austin Nadi, the Country Director of Dr. Save a Life Foundation. I'm inviting you to join this life-changing and destiny-reforming foundation today.
Join Dr. Save a Life Foundation.
You can be part of it by calling those numbers that are running on your screen right now, or visit our website on www.drsavealife.org. Together, we can save a life.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. You are still on You and Your Health. I remain your friend, Dr. Richard Okoye. Today we're going to do something that will be so practical. You know what I mean? It's so practical because it's nice when you are getting this information and it's so real. I mean, it's so real. And that real, we're going to have some level of, a lot of medical terminologies, which our mission here is to decode that medical terminology in a common man's language. Because the genesis of this, as I ever told you, is not because of those sicknesses are so ambiguous as it were, but because of what our fathers of medicine has actually perhaps on trying to, develop a sense of monopoly, form a fraternal group, as it were, so that only them can have access to the information. So medical terms come to you in big grammar. It's very unfortunate. It's affecting the system, and it is time for us, even beckoning on my colleagues, the doctors, to start breaking these walls down. And today's edition, we're going to look at these chairs. Many people do have pain here. Heartburns. Oh, pain is coming up like that, and all that, and everybody diagnosis is that when you have pain here, it will say you have ulcer. Hear me and hear me very well. That someone has pain here could have a lot of meaning. Many of them could be life-threatening. That having a pain on your chest here, epigastric region, or indigestion, or having pain, hey, it's not ulcer. Don't start with that. I will expose so many things to you, and I beckon on you. Whatever you are going to get right now, think about that, your friend, your loved one, having a similar challenge. And unfortunately, when people take one thing or take one drug according to the general prescription and nothing works, the next one is that you have the spiritual merchants all over the country today that will tell you, no, that very problem is not medical. Satan has so whitewashed our mind that our traditional mindset is what we share today in the churches. And I will tell you, because I'm going to make it a topic here, to let you know that crisis we are having in healthcare today, a number of spirituality in terms of spiritual houses, some religious organization, has been the undoing of the healthcare sector in Nigeria today. But we must have to start in this country, to start from the known before we go to the unknown. Now we have the opportunity to be in position to get this your heart, dissect it. You will see everything that happened around the region, and I will tell you beyond what you know or what they think could be responsible for that problem. Stay tuned. I'll be right back.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. In today's edition, I want to show you something here. Now look at me. This is my chest region, all right? And when I have pain here, classically, you can have pain that comes this way. It could go related when you have not eaten, sometimes even when you've eaten, and that very pain reflects to your back. Most times you will have such pain, and typically we tell you that it's peptic ulcer. But now let us look at it from a holistic angle of a doctor sitting down to be in position to ask you questions with respect to chest pain. All right? Now, there's what is called differential diagnosis. Differential diagnosis. You remember I said there are three types of diagnosis. You have the differential diagnosis, tentative or working diagnosis, and you have the definitive diagnosis. Now, a doctor you have met, his mind is beyond what you think, so he has a broader dimension of what could be responsible for it. Now, looking at me here, number one thing is, what are the organs that are right here about this axis? And what could happen to it? Now, let's look at this. Okay? I want you just to look at this very, very critical. All right? Because if you have a look at this now, this is the chest region. Okay? Then, in this very chest region, you have, for a female, you can have the breast here, but you have the two lungs, all right, here. You have the heart that is somewhere here, covered by this very lungs, so you will not see it clearly. And then, at this very level also, you have the liver, you have the gallbladder, this very green one under it, okay? You also have the stomach. Behind the stomach, you have what is called the pancreas. That is the one that actually produces insulin, all right? Then you have the esophagus that goes below that. All right. So you also have the muscles that cover this very place. Despite the fact that these organs appear to be separately located, one unique thing is that God made this very organ to be wired together to an extent. What do I mean by that? Let me show you something. This is what is called nervous system. All right. Right from the brain, there's a lot of wires of nerves. These are the ones that give sensory signals. What I mean by sensory signal, pain, the feeling of touch and all that. These nerves actually give those information. But you can see how the nerves, like different wires, all about the chest region, there are so many of them clustered together. All right? So, you look at it from here more beautifully. Watch this. You can understand that with those nerves we saw, wires as it were, just so you can understand. Electric wire, you connect the house. But it's coming from a source. Now, you can see that all these things are all wires. You can see them all within this very axis. They all wire together to a very large extent. So, when it has to do with this wiring, now see the implication of it. Having seen this organ, even though they are separately located but wired together, it implies that when you have a pain on your chest, your first line of thought, could this be coming from my heart? You know why that should be the first line? Is because that is where the life is resident. Remember that when someone's heart stops, every other thing stops. Somebody can have stable or unstable or angina that can come as a pain right there in the chest, because it's coming from what could predispose to what is called heart attack, myocardiac infarction. So, and at that particular point in time, somebody may have issue that originating from the heart, but he's saying, I'm having pain on my chest, I'm having indigestion, I'm having dyspepsia, and all those kind of feeling of heartburns, all that and all that. It may not necessarily be ulcer. Does it make sense to you? So I'm talking right now as a doctor, trying to define differential diagnosis, that this I have as a pain could be from 1, 2, 3, 4, 5, 6, which I'm going to narrow down right now. All right? Now, we go further. Oh, this thing we are talking about could come from peptic ulcer. Ulcer is just when there is something like wound right inside the inside, from the mouth down to the esophagus, down to the issue that has to do with the intestine and all the rest. It could also come from gastritis, inflammation of the mucosa of the intestine. It could also come in from inside that particular intestine, inside at the level of the entrance of the food into the stomach, where you used to have what is called reflux. You remember that? You could have what is called hiatus hernia, whereby the inside of stomach, which carry a lot of acid, is trying to come up into the esophagus. Most time it causes a burn, serious one. Some people can eat very well with it. All right. That could happen. Hey, this very fellow may even have problem that has to do with gastric cancer. Cancer of the stomach could be there, even of the esophagus could be there. A lot of things. When you have to go through this very place, to go inside the stomach, to start searching for all this. It's not all about ulcer. I've mentioned several things right there. It could come, gastritis can be found, esophageal cancer can be found, stomach cancer can be found. You can also have what is called hiatus hernia. It could also be found. You can also find some other things I will show you here when it has to do with what we do about that. Now, that's one. You could also go further about the neighboring zones, because we say that the wires are all connected. Just like, in a house you wired, if you cut a wire this way, a bulb somewhere could cut off, because that is the wiring, that is the networking. All right. Now, you could also have a problem coming from the liver. It could be a liver abscess. It could be an issue of liver cirrhosis. It could also come from the primary cell liver carcinoma. It could come from a number of things right there in the liver, transmitting the concern here. It could also come from gallbladder. Now listen to me. You can have what is called gallbladder inflammation, called cholecystitis. You can also have gallbladder stone called cholelithiasis. You can also have gallbladder cancer. We lost one of a major lady in a custom, and what happened? This woman had a problem of this ulcer, say having chest pain, and they went on treating her, drinking all manner of things. From there, she went into supplement. From supplement, she went into it's a spiritual problem. Only for her, towards after the whole thing, just a scope that was a camera that was put through the abdomen, lo and behold, a huge cancer of the gallbladder already spread through the liver and spread on the intestine. At that point, what could happen? He said, no. Fly her to India. They don't do magic. They don't perform miracle. It is based on what could be prevented at the right time, attention be given at the right time, that you can get hope from. Over there, they did all the bypass to enable her to eat and all that. She came back here soon after. She's late. In summary of this differential diagnosis, we have mentioned so many. You can imagine that. But somebody will say, no, I know this one. I've mentioned so many. And did you know that a case of pancreatic cancer, inflammation of the head of the pancreas, boom, the pain will also be here. A lot of them, and so many of them, right in there. That's why I say that again and again. Early detection of any medical disease, including cancer, is as good as prevention. I do hope you are getting something here. Please, pay attention to it. You can save your world. You can save your loved one. I tell you. You can save your loved one. You can save your friends. Do you know what? When you do, you will now realize truly that Nigerian life expectancy is already getting increased as I'm talking to you. God said that my people are destroyed for lack of knowledge. But worse is that he said, because you have rejected knowledge, I've also rejected you. Many people's crisis, health crisis in Nigeria, in Africa as large, has been all about ignorance of health information. That's why what we are getting here today, hold it firm. I tell you, it worth more than money. What will cost you millions and millions of naira, tens of millions to pay for. The knowledge you got today can minimize it to nothing. I do hope this very program has been a blessing to you. Always in this station, make it a date. You will not regret, because it worth more than any other thing you can think about. I want you to stay tuned, and when I come back, we will now go further to ask ourselves, having all this, how do we narrow it down to the point of knowing that this could be my problem? And I do hope you will be glad to have such information. Stay tuned. I'll be right back.
I'm more than 50, but God, in His mercy and grace, today I can breastfeed.
I never dreamt in my life to be in India, neither enter plane before I died at the age of 70. My vote of thanks to Dr. Saving a Life. I'm very happy with them. They've not revived my life again, no matter the age. Now I feel I can live a little longer than I could have lived.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. I do hope you are following. You know, someone called me on phone and said, Dr. Richard, if you had taught me in school, I would have been a medical doctor. We are not actually working on giving you a certificate here. What we are working on you, getting to know. What we are doing here is not just someone trying to say, because I'm a medical doctor, then I'll have to talk. No. Listen to me. This very program is a calling, it's an assignment, it's a divine mandate. And that's why that very grace to communicate to you in a manner you should understand. And what is the vision 2025? That this very country, full of hope, healthcare. I want you just to even say, I trust you. Yes, I will not disappoint you. That by the year 2025, This country will have a good news to share, that our life expectancy of our people, you can meet people that have labored and can also be there to eat the fruit of their labor, healthy, not just by the time the person is 80 years, by quality of health assessment, the person died 30 years ago. That is not the type of one we are talking about. Live healthy, above 70 and keep on counting. It's possible. Can't you see it happening already? That what would have killed you or killed your loved one by reason of ignorance, you have already known. So that one is already a bypassed information. Now, we are today looking at the issue of chest pain or thing related to this very chest, and we saw so many things. There are so many organs here that a doctor being in position to look at you talking about that, his mind may not be telling you what you are thinking. He's thinking vast. All right? Now, we are looking at it. Is there anything that we do to be very sure that this very chest pain I'm having, that is not something I do not know? First and foremost, you take things in order of priority. When you get here, what is that can kill a man? A man that has issue of cardiac arrest is gone if there is no immediate intervention. A man that has issue of heart attack and there is no obvious intervention, the man can be gone. Because when the heart of a man stops, life stops. That is to say, first priority. Anything that gives you a concern or pain in the heart, heaviness in the heart, upper abdominal pain and all that, even a sense of fainting or whatever, do your ECG. Check out your heart. This issue that ECG, electrocardiogram, is it analyzes the electrical activities in your heart and could be able to tell us if you are having a problem or heart block or there is a problem somewhere in that particular one. Very, very key. In a situation that becomes a concern from the finding, what is called echo. Echo could be in position to be done for further analysis. But I will tell you one of the major challenges we have in this country. And that major challenge is that we have equipment in several hospitals. We could do ECG, we could do MRI, we could do CT scan, we could do echocardiogram, but unfortunately, interpretation. That sometimes, as a matter of fact, even some that travel abroad, when I see some of the things they did as a health check, it's either they were told on what they found, but they were not aware or understand what the doctor was talking, or they were told that you have this very problem, and they told them, please, you have to go for intervention. You may not have money to do it abroad, or because of the issue of I need to rush back. He will come back. And he asked me, he said, I just did my medical check abroad. Is it medical check for what? Is it not to be in position to check yourself, get the right diagnosis, and give you the right treatment at the right time? That is the essence. And some people say, I have this very diagnosis. So, because of the issue of poor interpretation of those ECG and the poor interpretation of those echo, we have today been able to mobilize in our campaign to prevent heart attack in Nigeria, cardiac arrest in Nigeria, to do ECG for all Nigerians. Listen to me. You can partner with Dr. Save a Life Foundation to get it done for your company. Save them. They are your value. They are your money. So let us begin to see the asset we have in people, not in the building you will live and go away. Your asset be in your people. You have a constituency. We can partner together and run ECG or basic health care that should be able to help this one and prevent the inevitable. We could be in position to work together. Get it done for your constituency. Get it done. Whosoever you can, wherever you are, be in position to do that. And furthermore, we've also provided this platform in a situation where you have your ECG report, even where you are right now. I tell you, this very line we are dedicated this line as a heart hotline Africa. It is actually designed that if you have any form of ECG, echocardiogram, whatever you could on your own, you can snap it and send it even if for second opinion. We have mobilized international cardiologists, local cardiologists to be in position to give proper and right interpretation to them. We have suffered a lot of problems of misdiagnosis, poor diagnosis, and all that. So at this very point in time, make this number a number you can keep, not only for today, even for tomorrow. Use this very number for heart. You've done your ECG, you have done your echo, load it there. International and local cardiologists will look at it and we send you back the report free of charge. You are not paying anybody anything for that. We also open this very portal for diagnostic centers, hospitals, doctors. You want to have a second opinion about any form of the case with respect to the heart, send it to this very number. At least get second opinion. Second opinion is allowed in our medical practice. It's all free. But I also want to appeal to you. In a situation where what we are doing here is something that touches you. Look, this program going on in this station, it demands a lot. But we are believing God that this will not stop until things turn around for our people. In this very Dr. Save a Life Foundation account, you can put anything to support this very movement. Anything can save someone. I have seen the value of just giving a little for someone. And very unfortunately, like what is obtainable in America and in Europe, where people can freely support health program. But here it seems as if it's very difficult. It's supposed not to be so. So on that very occasion, anything you can use, you can even call this very station and say, hey, I like what is Dr. Save a Life Foundation is going. You can call them, you can be in position to transfer money to them. Just send us something for us to be in position to appreciate you for your support. All right. That's very, very essential. So, issue that has to do with the heart, your ECG as a routine doing, and also the issue of echo where applicable. All right. Now, we go further this time around to look at something that has to do with what I've explained to you. From this your mouth into your stomach, I say we have more than 5 different things that could be responsible for the pain one is having in the chest. And we say it could come from esophagitis in terms of the inflammation of the esophagus. It can come from the cancer of the esophagus. It could also come from the cancer of the stomach. It could come from the peptic ulcer. It can come from hiatus hernia. It could come from gastritis, and a lot of them. Now, have a look at this. Now, this is what is called endoscopy. In the current dispensation, when it has to do with treatment of whatever you call it, ulcer, the technology say you see before you treat. What do I mean by you see? You do a camera evaluation by putting a camera through the mouth right there into the stomach. You call it what is called endoscopy, which is of 2 types. You have the gastroscopy, that's through the mouth into the stomach, and the other one colonoscopy through the anus into the large intestine. In another development, you could also have what is called gallbladder stone. That one you could be in position to do abdominal scan, which will be able to tell you if there is a stone in the gallbladder or if there is an inflammation of the gallbladder. You can laparoscopically be in position to take this thing off from the body without needing to cut the body open. That is what is going on here. It is called laparoscopy cholecystectomy.